Today we're going to talk about a very exciting study and about a boy whose dream recently came true. Hemophilia, as you may know, is a severe congenital bleeding disorder. Because of lack of coagulation factor, either factor 8 or factor 9, you do not form clots properly, so the clotting time is longer. Clots are more susceptible to fibrinolysis. They break out very fast, and patients experience spontaneous joint bleeds, muscle bleeds, and even life-threatening bleeds such as intracerebral hemorrhage. So the hallmark of hemophilia care has been over the years the administration of prophylaxis. And prophylaxis means giving intravenous coagulation concentrates, replacing the missing coagulation factor. This is done twice or 3 times every week. Imagine, even for small babies. So the burden on the patient and on the family is very, very high. Recently, our paradigm of treatment changed. From factor concentrates, we began to use non-replacement therapies, and we are even aiming at cure of hemophilia by gene therapy, but that will be in the near future. Regarding the non-replacement therapy, we already have a registered drug for hemophilia A that mimics the action of factor 8 and is given subcutaneously. But we had no such drug available for the hemophilia B patients whose factor 9 is missing and who still suffer severe and life-threatening bleeding episodes, especially the poor patients who develop anaphylactic allergic reaction to the factor concentrates and eventually come out with inhibitors to the factor that render care insufficient and ineffective. So I would like to tell you about a very interesting study. This is not an 8-mimetic or a 9-mimetic study. This is a study that rebalances the whole coagulation cascade. In this study, an inhibitor towards the tissue factor pathway inhibitor was given to a little boy with hemophilia and inhibitor to factor once weekly subcutaneously. That boy, who used to come to the hemophilia center for treatment, for whom prophylaxis was never available, so the family used to spend weekends in the emergency room and hospitalized to get repeated doses of other coagulation factors in order to construct better clots. He used to suffer joint arthropathy. He used to suffer severe pain. He was always susceptible to life-threatening bleeds. That boy started getting this factor due to clinical trial in our hemophilia center. He is currently receiving this anticoagulation inhibitor in the trial. This is a completely new experience of rebalancing coagulation without replacing the missing factor. It enables the parents better care because they can administer the concentrate subcutaneously at home rather than running to the emergency room or to the hemophilia clinic for IV infusion. And that boy's dream was always to play soccer. He was never able to play soccer. I, as his physician, usually told him soccer is completely forbidden. You will start kicking, you will get injured, you will get repeated bleeding, and that boy used to come out of my room miserable every time. Last week, I got a special photo that his father allowed me to publish here. This is the boy. Of course, you see him from a distance, and he's playing soccer. So due to the studies and the progress of techniques of care in the Israeli National Hemophilia Center, that is really a center of excellency with regard to clinical trials in hemophilia, this boy's dream now came true, and I'm very happy to tell you about it.